evening. I am Lorraine Fraser, and I have the distinct honor as serving as your dean. To begin, I'd like to read our school's land statement. With School of Nursing, I welcome you, your family, and friends to commencement. You're aware Columbia School of Nursing has a long history and tradition of excellence. We graduated our first class in 1894. Imagine how much has changed since then. The experiences of last year, as we faced the twin pandemics of COVID and racism, added ever more resonance and influence, and that our expertise and leadership will not just be sought out, but will be celebrated for generations and centuries to come. So today, as we celebrate this milestone, we also celebrate what this milestone means to the future of nursing and to its enduring impact on people's lives. I would like to now acknowledge our graduating students for your contributions during this extraordinary year, your adaptability as we transition to virtual education, and your continued commitment to nursing. I am moved by the impressive resilience that I've seen you display as you handle the challenges this year has. I'd like to mention just a few of the highlights of 2020 and 2021. One of the innovations that I'm proudest of was anticipating the strain of the pandemic's first surge that it would have in symptom management, nurse staffing, LGBTQ+ research, and research on people of color. Finally, on the clinical front, I'm proud that early on in the pandemic, we collaborated with our medical center colleagues to temporarily transform the Nurse Practitioners Group Washington Heights office into a COVID-19 cough and fever clinic. This helped offset the patient intake at nearby hospitals. The Nurse Practitioner Group also participated in a research trial, which involves screening recovered COVID patients for antibodies to determine their eligibility to donate plasma to hospitalized COVID patients. Our clinical practice has also become more essential than ever for the homebound elderly in Upper Manhattan who rely on our House Calls initiative. I feel a great pride and expectation as you prepare to take your places in the healthcare system and use your expertise to strengthen our society and help our people.
And families and friends of the class of 2021. It is a privilege for me to speak to you today. To the graduates, it's an honor to welcome you to the healthcare team. The importance of teamwork has never more been evident than over the past year and 3 months. The pandemic tested every member of the healthcare team, and nurses have been recognized for meeting the challenges with utmost courage and fortitude. What you have learned here is a great starting point, but only a start in your lifelong learning. We know this one constant to be true. Healthcare will change, just as it has changed over the past generation in ways we could not have imagined. Our distinguished faculty have prepared you, and all the things we know are.
It is my great pleasure to introduce Dr. Mary Wakefield, who will receive the Second Century Award for Excellence in Healthcare. This award was initially established as the Centennial Award. It was later renamed to reflect the school's second century of educated nurses. Since 1991, we have presented this award to individuals who portray excellence in advancing the health and well-being of all citizens. We're honored to have Dr. Wakefield join us for graduation. She is a visiting professor in the practice of healthcare at Georgetown University and also a visiting professor and distinguished fellow at the University of Texas at Austin. Dr. Wakefield has a depth of experience working in the federal health policy space. Most recently, she served on the Biden-Harris transition team. As a member of the Obama administration, she served as acting deputy secretary of the U.S. Department of Health and Human Services from 2015 to 2017. And as the head of the Health Resources and Services Administration, or HRSA, she served from 2009 to 2015. At the Health and Human Services, she was responsible for overseeing management and operations of the department with a $1 trillion budget and 80,000 employees. and she led strategic initiatives in key health policy areas with a particular focus on programs for vulnerable populations. At HRSA, she led and initiated program improvements to further strengthen the healthcare workforce, build healthier communities, increase health equity, and provide healthcare services to people who are geographically isolated or economically or medically vulnerable. Dr. Wakefield has extensive academic and administrative experience. In addition to her current appointments, she has held positions at the School of Medicine and Health Sciences University at North Dakota, George Mason University in Fairfax, Virginia, and the College of Nursing at the University of North Dakota. She has served on a large number of governmental commissions, public and not-for-profit boards, and committees bringing expertise in nursing, healthcare quality, and access to care and health workforce. Dr. Wakefield served on the Institute of Medicine's committee that produced landmark reports, To Err is Human and Crossing the Quality Chasm, and chaired the committee that produced the report, Quality for Collaboration, Healthcare in Rural America. For her inspired leadership, innovative thinking, and contribution to the health of the nation, Dr. Wakefield was chosen as this year's recipient of the Second Century for Excellence in Healthcare. I am honored that she is able to join us this evening.
Thank you for that kind introduction. It is an honor for me.
Direct entry graduates.
Here we
Who are
go.
the future masters
Ooh,
prepared
this is long.
registered nurses equipped to deliver equitable, high quality, compassionate care to their patients and communities.
Come on, Angela.
Arias Indigo Aliyah Abruzzi Davis.
Ooh, that's long.
Philip On. Sarah Alhamy. Andrea Anea. Anna Olivia Anderson. Jordan Arbelays. Adoranki Awalasi. Megan Boz. Karen Baldwin. Hema Benheim. Ian Benjamin. Cassidy Bernstein. Amanda Black. Timiteo Esther Bolateo. Naja Boyd. Emma Brown. Angela Jeanette.
Go, Angela.
Talita Campos. Alyssa Sieber.
Girls need blinders so they can step out of bounds quick. The sidelines is lined with casualties who sit like casually, then gradually become worse. Don't fight the apple eve, caught up in the in crowd. Now you're in style, and in the winter gets cold and bold with your skin out. The city of sin is a pity on the whim. Good girls going bad, the city's filled with them. Mommy took a bus trip, now she got a bus out. Everybody ride her, just like a bus route. Hail Mary to the city, you're a virgin. And Jesus can't save you, light starts when the church in. Came here with school, graduated to the highlight. Ball players, rap stars, addicted to the limelight. Got you feeling like a champion. The city never sleep, credit slip, you an Indian.